Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev, and this is a team of Presidential National Hospital in Almaty city. Today we have a patient with a giant fusiform partial thrombosed aneurysm. It's look like there is something happened in this region. Later we will check. Patient has a bypass. Several months ago the bypass were placed, and now patient came for the main treatment. 2 days ago my colleagues made a balloon test occlusion, but test occlusion was done with double lumen eclipse, and the lenticular striating artery were temporarily occluded, and the patient start suffering the hemiparesis. And then the result of balloon test occlusion was postponed because of the possible neurological deficit. But the bypass is patent. And now we have dilemma. It's possible just occlude the artery, and on MR the aneurysm starts from here. This is a part of the aneurysm, and this part is partially thrombosed. If we see the MR angiography, trubka. 1.3 millimeter is a stenotic point of the MCA. And now we have dilemma. Dilemma because of the result of balloon test occlusion. It's so-called diffusion, perfusion, confusion. We have the same confusion because of those results, and the aneurysm is quite big and it's partially thrombosed. And it's look like 14 millimeter. It's the functional part is not really giant. It's 11 millimeter. 14, and now it's a 12. Have dilemma because of the angulation at this point. It might be stent. We can place distal stent, and then we can coil this part, and then we may continue with the stenting in proximal part. Or it's possible to place proximal stent, distal stent, coil, and place one more stent in between. The question number 2, what to do with this stenosis? Is it necessary to do angioplasty in this segment or not? 1.3 millimeter is not so bad. This is 3D angiography. It might be small perforating branches coming from the aneurysmal sac. Might be from here. And there is a trifurcation. Yes, Davlet is Davlet see the similarity between the gastrointestinal tract. It's like a gastro. Okay. And now we have this situation. For me, it's possible to do it in this way. This will be the stent. 24 millimeter, maybe 26. Usually it's a 2 stents. So we have 3.5, 3 millimeter 25 Leo babies. The question is which one should be first? This one. We can place this one and place the balloon here, do coiling, and then place another one. Or place the stent here, coil, place the balloon here, coil here, and then continue with stenting. Okay. But the idea is to place the braided stent, because this segment is also aneurysm. Till this point, it's an aneurysm. The bypass is patent. That's why there is a dilemma. Should we protect MCA, place stents, or just occlude the artery? It's all the time dilemma. Okay, we discussed with family about the possible strategy, and I think if wait. Another question, should we do angioplasty? With the 2 millimeter balloon, it's possible to do angioplasty here. No. We can start with the angioplasty and then place a stent. Okay, let's take Xeon Blue, coronary balloon 2x9. Еще дурс. Okay. We will take 225 by 15. I think it's okay. Nanoshes. Xeon Blue. Наше солнце. Ошибемся? На хэд выложить наш солнце. Yes, the patient is quite young. She's 54 years old with headaches. It's a symptomatic one. The only problem, we could not deliver the Elvis Evo through the let's see. Так, пока твоюсь. На наш слож, Eclipse. Yes, we will open the Eclipse double lumen for the case of emergency. And also there is a Elvis Evo 325, 3.5, 25. Okay, let's see. Madina, oradan başlasız aytkan кезде. Yeah. Қазір. Просто. Так, и... Мыналардан бастап ашасыз, сосын анамен жалғастырасыз. Мынаны обязательно ашып қойыңыз. Осторожно. Yes, my name is Mynzhylky Berdikhojayev, and my first assistant is Maksat Musabekov, Kaneka. And the second assistant, Kumarova, да? Ахбаян. Ахбаян Kumarova. Баян. Accordion, yes. Anesthesiology team is Asılcan with Bakhat. And the operating nurse is Madina and Nazım. And video support presented by Video Company. The boss of the Video Company, Evgeny Grishayev, is in the team. And today we are working through the, it's an 8 French pilot catheter, yeah? Maksat, pilot pa? Yes, pilot company from the Phoenix. Чекает баллон салса. Это.
Только кончик трудно выпустить, сперва 220 гидрофильно провели, по нему потом пилот провели.
А чем-то проходили? А вначале чем прошли?
Пятеркой, вон.
Окей.
Провел гидрофильно 240, потом по нему пилот.
Рыбомида. Что там? Hello. Okay, young lady with this kind of aneurysm and pilot is a like Neuromax. It's 6 French guiding sheaths, which is 8 French guiding catheter. And now we will use Kaneka coils, Japanese coils. We have lost several coils from the Kaneka company. It's very uncomfortable to use, but there is no other option. We should utilize these coils. It's a quite soft coils. It's a long and maybe it's better to use in AVM, but the problem is detachment system. This detachment system is only, and we have no another new one, and we asked the company to find us one detachment cable. And thank you to Tarlan Int company. They helped to find one detachment system. The sterilization of the detachment system is nearly impossible. And the new one is costly. It costs nearly $400 or $500. That's why we decided to stop to use the Kaneka. It will be the last time when we will deal with these coils. I asked Maksat to bring the Camus balloon, which is 225 by
Ну, дефект
15.
остаточный.
Жо, өрлеп көрсең?
Өрледім ғой.
Өрленді ма? Жо, дефект емес ол. Аха. Ішінде ауа жүр ғой. Былай аударда ауасы бірінші кетіп қалады. It was a thrombus. Yes, the first we took a xeon blue wire and a 225 by 15 coronary Asahi Duvan Camus balloon. Patient under general anesthesia. This procedure could be long. That's why. Yes, and the other option, if you noticed, the time between patients is quite long. When we work on working days, it's usually like this, because the staff is involved in the regular duties. Okay. Now we are inside the aneurysm. It's better to have non-contrast part. Just a second. I will place also the eclipse to be ready for any kind of emergency. We took eclipse double lumen, and I will bring the eclipse double lumen to the M1 segment for any kind of emergency. Yes, it's like a second parachute. If something should happen, we will take a security. It's a latex, like a condom. Huh? The sex is safe when you use latex, when you use protection. Yeah. We need a security. Солай ғой, да, Мақсат? Секс должен быть защищенный, да? Yes, everything is moved. But unfortunately, balloon is in place. Now we will bring the eclipse double lumen. Okay. We will use it like a monorail. Okay, we can go distally. That's okay. Let's leave it here, and now we will continue to work with the coronary device. It's a 15, no? Okay. Just a second. It looks like there is some kind of ischemia. Just a second. Yes, I agree with Maksat. We need to magnify the view. Okay. Snot mask. Медленно раздуй. Номинально 6. I will give nominal pressure, which is 225 on 6 atmospheres.
4.
Окей, держи. I asked Maksat to keep the balloon inflated. There is a fast stagnation. And it should be also the cortical collateral circulation. You can see nicely the bypass назад. Yes, the bypass is functional. And the territory we couldn't see now, which is the territory of parietal lobe, now preserved with the bypass. Без напряга же, да?
Yes.
It was at 225 and we inflated till 6 atmospheres. If we will inflate till 14 atmospheres, it will be 2.4. But I think we don't need 2.4. But 2.4 is okay. Yeah? Тогда чуть-чуть держи. 12 бересің. We'll give 12 atmospheres. Без напряга?
Вон напряжение восстало.
Все, стоп. There is a little bit tension on 10 atmospheres. 10 atmospheres, the balloon became 233. Okay. Сдувай. Okay. Yes, it's much more better. Максат, получше? Yes, we may compare.
Чуть-чуть подтянуть еще там.
Okay. We will bring the balloon. Now we can give another. Вон, бересің сразу. 6-ға дейін быстро и 10-ға дейін медленно.
6. 8. Вон.
Сильно напрягается?
Нет, не сильно.
12 бери.
Вон.
Okay, now we gave 12 atmospheres. We will leave. Подержи. Подожди, ктютер. Yes, the balloon is undersized, and you can see the difference between the size of the MCA and the size of the balloon. Now we inflated till 12 atmospheres. 225 balloon on 12 atmospheres is 238 millimeter, nearly 2.4. I think those diameter is enough. Все, сдавай. It's okay. Let's do control. Yes, now it's much more better. Yes, with wire we are staying in the.
Спокойно, still говорим. Спокойно.
Yes.
Блай можно продлить спокойно. Когда 2 стента в один можно поставить. А по краям стента можно спирать закрыть.
Okay, now we will take out the. We took out the balloon. Не, проводник бересің. We can use this wire. Андық столға апсайсыңдар. Yes, Xeon Blue is quite soft wire and There is 2 points. The point number 1. Could we place the stent through the eclipse? I think not. It might be a little bit problem. It's not recommended for the. It's not recommended for the Elvis Evo. But it's possible to push the Leo baby. Maksat, should we use Leo baby? No difference, huh? Okay. Let's take Leo baby 325. Leo baby 20 без. Подожди. Maybe we will go with the eclipse for the coiling, and with the headway we will place a stent. Okay, let's do it like this. Okay. Kaneka спираль 16'da 30 дегені бар. 16. Что там? Давление играет, да? Все хорошо. Все. Оны арасында қолданып жүреміз. Жаңағы ашып тастай салыңыз, Мадина.
Пищик ваш аппарат. Аппарат пищик. Қайсына 16 ма? 16 ма шевеш.
Жаңағы 10-30 ашып тастай салсын.
16 ше.
Ал. Екеуін де аша беріңіз. Yes, this branch is more straight one. Okay, this one is more straight. We will place stents through the headway duo, headway 17, and Stent айтам қазір. Ашпай тұра тұрыңыз қазір, 1 секунд. Ашпай тұра тұрыңыз. Just a second, bitter. Entschuldigung. It will be no markers for the balloon. I will close it and place it like this. This is for stent, this is for the coils. Okay. Let's check one more time. We should be... Yes, the patient was bypassed in a different hospital, and the strategy was chosen to split in 2 different sessions, and okay. We have Elvis Evo 3.5 by 22. Шарын 22 бар ғой. Сол дұрыс болады ма? И 3-те 25 бар, Leo baby. Так, тұра тұрыңыз. Мынау егер қысқарса 3.22 болып қалады. А мынау қысқарса 3.5. 3-те 25. Осыны көрсетіңіз. Ол 18-ге дейін, 16-ға дейін қысқарып қалады. Elvis 3.5 22. Yes, we will start with Elvis Evo. We will partially open the stent and place the coils. We'll make the carcass. We'll make the basement, and then just a second. Бірдеме де пиқылдап отыр ғой.
айтшы аналарға аппараттары пиқылдап жатыр.
Давление төмен түсіп кеткен шығар. 89 ғой давление. Okay. Through the headway 17, now we will start placement of the LV Sivo. And after that, the coil number 1 will be Microplex 1036, I think. It will be coil number 1. And this is the best coil in the world, which is Kaneka. Will be the coil number 2. This is coil number 2, which is very specific coil. Okay, coil number 1, coil number 2, and the stand. Now we have a Mynzhylky 3.5 by 22. And thanks to Phoenix company, they gave as a sample the guiding sheath pilot from the Phoenix Wallaby, and as nowadays we have several guiding sheaths like a pilot catheter, which is Neuromax first, and then the second one is Lucas ballast catheter, and from the same category. Okay, I think this place is quite safe, huh? Безопасно же. Или тортаем чуть-чуть. We can place first coil, and then after first coil we can reposition the stent. Okay, let's see. Mynzhylky, знаешь? Mynzhylky, знаешь? It's quite distal, huh? We can bring a little bit, but then stent may move. There is a flow from bypass, that's why it looks like something like thrombus, but there is no thrombus. There is a flow from bypass. Oh, we can place the stent. Okay. Now I think we are in a safe position. We can divide the aneurysm in 2 points, the distal part and the proximal. Oh, I think stent is okay. We can bring a little bit proximal, but I think it's okay. Okay. Let's start coiling. Гепарин 5 мың. Гепарин істесасын. Итерер. Кірді ма?
Гепарин 5 мың.
Так, Канека 16-15 деген бар, соны ашып бере беріңіз. The first coil is Microplex 6 at 10:30 something. It's very important not to go through the stent. I'll bring the balloon a little bit back and then can place the... Yes, it's around the stent, not inside. It's very important. I don't know if the coil is out or not, but it should be okay. It's okay. Так, микроплекс. Okay, coil number 2 is the best coil in the world. Екінші нарып sayılır. 16-15 тағы біреуін ашсаңыз. Скорее всего. Смарт мозг бір бассаш. Смарт мозг. It's a thin coil. Okay. Now there is a special system. Huh? Then we need to... Okay. Тут. Давай, götürüyor. Тағы да 16-15 ашып бере салыңыз.
16-15 нешеу бар?
Келесін аша беріңіз 16-тан кейін. Келесін аша беріңіз, үлкен спираль қайсы бар? Канека. Аша беріңіз оны. Сол жерде канеканың бәрін ашып тастайсыңыз. Коробкадағы канеканың бәрін ашып тастайсыңыз. Just a second. Just a second. Так, это какая проекция была рабочая? 45 краниальная длина. Let's try to see. It's nearly impossible to see where is the stent. Huh? Okay. It's clear. Ветер. Котник их засунул. It was not detached, huh? Like in casino, huh? The Japanese engineers created the voice like in casino, huh? It's my... Sen maiskuit.
Şarkıyım mı?
Şarkır. Назад. Давай. Окей. Келесін жапсайыр. Мадинада сосын 9 деген канека бар. Я ашып сөйлеміз. Похоже, да? It's not detached.
Все, примерно. Ты тонешь, не спираль.
Это точно канека была, да?
Канека, да? Ну, спираль. Еще.
А, детached.
А?
Теперь отделился. Угу.
Все, nice. Ну, весил так штука одна мама.
I think it was detached, да?
Ну, Бerdikhojayev.
Это не спираль виновата, да, как они скажут? Okay. As we keep coiling, and I think it's close the time to detach the first stent and place the second stent inside.
Ну, одинаково.
It's quite okay. Проксимальный мешок ты ölçek жасаш? Особенно.
Өлчеп.
Yeah. Значит, лай и лай. Не, ниже, ниже. Ага, вот так. И по ширине. Еще раз. Так.
Power директор. Gözücüm ne kadar var?
Жоқ қой.
Директорна.
Ну, все хорошо. Пока аж потрется.
А сколько?
Okay, just second.
здесь где-то пятерка, да, нужна?
Сейчас, секунду, не торопитесь. Может, как стенд both at once. So again. It's a 9 by 30 coil. Continue with Kaneka. Okay, let's do and draw and let's see. Стенд сәл тартайын бөлді, тұрған жер нормально.
Нельзя, она уже спираль кысқалды, потому вы аж все сопли.
Okay. Smart mask. Now we'll deploy the first Evo. It's fell down, huh? Okay. There is an angulation between the vessel and just a second. It's quite stressful situation. Yes, the stand is opened. Yes, it's on the just on the angulation.
Давай возьмем еще один катетер и постараемся пройти. Баллон не убирай. Этим катетером.
Хорошо.
Постараемся пройти. Баллон не убирай.
Секунду.
Он для поддержки наш.
Она дистальный анатомисін бір көрсетіп жібересіз?
Чего? Стенка?
Вперед, стоп. Вот так, минус. Yes, I need a more clear distal anatomy. Smart mask. Smart mask. Пациент просыпается. Пациент просыпается. There is a spontaneous extubation, huh? Okay. Наркоз резко выдохол ғой. So I hope we didn't create any complication, but it's quite tachycardic stressful situation. Да? На открытой операции такое бывает? Пациент, травм не минут. Okay. I wanna go to the bathroom. Так, екі жарым дейді. Так, екі жарым, үш. Қазір тұрады, бір секунд. Өзімен өтіп көрейін. Может, ана проводник алды қарай өтсе? Не, это же не баллон, это же хедвей же.
А, это хедвей мы стенд, что ли?
Да, да. The stand went through the headway.
Нет, толкай.
Сейчас.
Пока он еще здесь.
I think the patient is moved, huh? It looks like patient is moved. Стоп. Смарт-маска. There's the problem with visibility because of the last coil. Okay, I'll leave it like this. Headway-ду қойып левый бяш бересіңіз?
Мен айтып тұрмын, хедвейдумен чекаймен давай заведем, потом от него подтянем. Просто мынау сейчас уперся, а катетер не согнутый, он упирается в стенд.
Нет, ты не понял. Headway-думен левый бяш саламыз один.
Я.
Элвис ЭВМС, левый бяш саламыз один. Все хорошо. Мадина Headway-ду аш беріңізші, 150 вольт.
Мадина, бізге еще одна система нужна. Да.
Okay, there is angulation, that's why we couldn't go. Жоқ, кер жоқ. Кері жоқ.
Акел, Y коннектор бер біреу. Или мынаны жалғастырайын ба?
Бере салсын.
Y коннектор бер и система. ходовой такой берет. Что ойлағым мынаған кіріп кетсек, соны. И анау болады. А системаң бар ма? Мына қоңырға жалғай берші ме пока?
Қоңыр ол гайд қой.
Иә.
Все хорошо, ладно.
Ергі беттен, е? И неңді дайында системамды. Че? Не ошибку па? Не ошибку па?
That's why for case like this, maybe scepter is preferable balloon catheter, but unfortunately we have no scepter yet on the shelf. It's a system, huh? Бірдемені бір жерге салған кезде бірдеме болады. Бірдемеден бірдеме болады. Кешке не істейсің, Мақсат? Бала-шағаны қашан алып кетесің?
Кешке не?
Кешке бала-шағаны нешеде алып кетесің?
Жоқ, бүгін алып.
Аэропортқа барайықшы, сағат 7:30. Лауралар келеді. Okay. This is most challenging part. When you place the stent and then when it's a problem to cross the stent with the same microcatheter, it's quite challenging situation. Now we should go from one side to another. Yes. Then it would be problematic. Ah, it's okay. No, it's okay.
Спиральның астында. Спиральның ішінде жүрсің.
Yes, it might be there. Yes, it went through the stent struts. Now we're outside. Oh, it's look like that's why in a case like this it's better. Okay, we need to keep the stent catheter and stent in place. For this reason it's very helpful. And now we will try to go again with the headway. It's quite distal. I will pull the device back. Now go inside. Yes, now it's better. Yes, we use the headway duo for the re-navigation of previous headway. Castrator. Now we should decide. Trator. No, wait. I will bring my headway duo back. Also, it's possible to use it. Yes, we can place coils from it. Okay. There is a balloon. There is a. Okay, let's take it out. There is a stenosis and narrowing. Now there is option to open the 4mm LV servo. The first one was 3.5.
No.
I think it was 3. Бірінші қанша болды? Диаметрі? Бірінші ванна.
Шарында 22 болды.
Шарм ғой, да?
Анау қазір максимально
Төртте 27 бар екен. Төртте 27 ева бар. Маған көрсетіп жібере салшы, Мадина. Yes, we have 4 by 27, ашып бере салшы. 4.27. Көрсете салшы. Yes, it's better. Better to open this one. Okay.
Или тоқта. Или мынау болады. Мынау болады.
Кіреді ма?
Иә.
Жоқ, болмайды.
Ана стенадан захват жасап.
Жоқ. It's a laser cut stand. Why I don't want to choose the credo? It will not change the flow. There is no ability for flow diversion. That's why I prefer to use Elvis Evo or Leo Baby or the stand number 3 braided is at Shiro Hill. But Evo and the Leo Baby is will have more experience. That's why I prefer to use. It's my habit, I think. Huh? Oops. I will increase the radiation. This point. Yes, the stand is arriving. It's quite long stand. That's why we can start just at the. Okay, let's start it something here.
Вот так, еще чуть-чуть. Еще чуть-чуть. Вот так. Давай.
I don't see my stand. Let's do angiography. There is a angulation, that's why it's not opened. Она угол нашла, потому что там баллон стоит. I think because of the balloon, it was not opened. Yes, now it's opened. It's opened. Now it's opened. Минус қойып үлкейтіп жібересіз? Минус қойды үлкейтіп жібересіз? Минус. Назад. Нет, просто стенд покажи без контраста. It's opened. Вперед. Yes, it's fault inside the aneurysm, that's why we can pull it a little bit back. Okay, let's do it like this. Now it's nicely opened. Huh? Okay. Smart mask. Yeah, kurisal. Okay, cheers.
угла.
Yes, now it's nicely visible.
Наш угла.
Okay, let's place the previous coil, which were 9 by something. I think it was the last coil. I'm not sure we need more.
Четыре. Четыре. Она же хочет что-то.
Just a second, boss. Nice, I think it's okay. Минус как пересол. I think there is a place for a couple of coils, but should we place or not? Мақсат, тағы бір екі спиральға орын бар сияқты.
Айкел, не видишь?
Тұра, қазір айтам. Подожди, не торопись. Может, не стоит стемпинговый пиццелом же?
Стоп, вперед. Чуть-чуть. Вот, держи. Вперед. Нет, назад. Здесь такой.
Он не выходит. Подожди, розет большой, Саша? I don't like this coil system. No.
Назад ловить надо. Ну, типа надо конца. Ну-ка, вперед. Назад сей. Чай назад.
It's not detached. I don't know why. Тұра, асықпа, сейчас. Анау 9 болды, да, соңғысы, или 7 болды ма? Ну-ка, төмен жағын көрсетесіңіз. Жарайды, не бере салшы? 4 дұрыс болады ма? Пятерка бере салшы, 5-15.
Шестерка ловишь?
5-17 бере салшы. Okay, let's take Optima, which is more predictable.
Да, не отделилось. Все на месте. На месте. Это от стенда. Не перепутался.
Не внутри же, да? Не встаньте же. Все.
Отделять и спираль.
31 дерисонс. Төртеу. Осымен болар. Құдай қаласа осыны салайық та, сонымен бітірейік. Қалған жұмысты стенд өзі жасар. Ұрайыр. Смарт мозг. Жетеді. Жетіп қалар, қазір бір әнге жасап көрейік. There is a lot of place, huh? Төрт дұрыс па, үш дұрыс па? Тағы бір төрт бересіңіз. Ай симайды ол мақсат.
Басында алттан бастады. Өткен 9 ойнап кіріп кетті оны бүйтіп.
Не буду я ничем играть. Спираль саламыз, шығып кете саламыз. И так много сделали. Радиацияны назайте, Саш, бірге дейін. I'm not sure we should do extra. I think it's enough. If it would be necessary in the future, it's possible to place the one more Elvis Evo inside if it's necessary. If it's not, it will work. And
Ретроградный жим стоял, да, на станции?
no, Maksat is joking. The bypass is working in retrograde manner. Huh? Значит, да, дәл солай нашылығы, да? Stent bifurkasyonu biteyim deyip durmaydı.
Массаж. Ровно стене koysam da olur abi. Oynatmaması işte.
Biraz daha otur. Otur otursun. Берсон. Проводник Берсон. Let's go with the balloon and we can do angioplasty inside, huh?
Akisi yaptım böyle.
Arttan bir şey gençler.
Ne dediğim değil mi?
Tut kırdı koyman. Bunu kırdı. Arttan değil mi? Aldından dur. Yes, now the stent is exactly at the MCA territory. Yes, we are outside of the stents. Now I will take out the headway 17 and let's do angioplasty. This is angioplasty. You can see exactly the stent. Okay. Yes, this is the location of the both stents. The last angioplasty. Just a moment. We can see the bypass now. Yes. You can see nicely the bypass. Bypass is working, no? Okay. I hit Gemma. Okay, let's decrease the increase a little bit. You did it. We are working more than 30 minutes, and I think if in the future it will need additional stand, then we can place one more in the future. Yes, the territory is clear. Let's see the control. Okay, this is a pilot guiding catheter. It's look like it took the angulation of the aortic arch, and the tip is hydrophilic. It's 100 centimeter, small angulation. It's like this. Okay. Let's see the expertity. Къде си сал? Мосткович. Къде? Okay, dear colleagues, this is a brain expertity. You can see the distal part, proximal part of the stents, and the brain is clear. This is after craniotomy, and it's clear. Let's see what's this. What's this? It's just a dura, I think. Okay, now we can finish, and the next case under local anesthesia, ICA aneurysm. See you in 20 minutes.